So when it comes to low laser treatment, it can go through a few phases. The facilitatory response, there's the inhibitory response, and then the indirect effect. If it goes through the inhibitory response and indirect effect, it will lead to reduced inflammation. Specifically in the inhibitory response, there's reduced intracellular pH, there's a decreased COX production, and that immediately goes to reduced inflammation. For the indirect phase, there's an increase of blood flow, which means there's enhanced lymph circulation, and there's a deposit of granulation tissue. That also leads to reduced inflammation. During the facilitatory response, there's increased ATP synthesis, and this can lead to either increased protein synthesis, increased cell proliferation, then increased enzyme activity, or it can go to stimulation of electron transport, which also increases the cell metabolism. Then with increased cell metabolism, that means everything is speeding up, which means there's vasoconstriction and vasodilation. That's dilation which happens, which also means there's an increase of cell membrane permeability. And then there's an increase of phagocytosis. This leads to tissue repair, which tissue repair leads to reduced inflammation and then eventually decrease in pain.